So Imeglimin, a powerhouse to type 2 diabetes. So if you see, this is a novel drug for type 2 diabetes with a differentiated mechanism of action. First in class product that targets mitochondrial dysfunction. It was approved in Japan in June 2021 and it is approved by DCGI in India. If you take type 2 diabetes and relations with the mitochondria, we have to see from the bottom. If you could see from the bottom and go up, you can see the causes for mitochondrial dysfunction. One is the glucotoxicity, lipotoxicity, environmental factors like obesity, intrauterine malnutrition, pollutants, risk alleles, imbalanced mitochondrial protein acetylation. All this leads to mitochondrial dysfunction. This in further leads to a decreased mitochondrial biogenesis and ETC leakage, increased lipid accumulation, increased ROS overproduction, and all these things leads to increased cellular injury, decreased antioxidating capacity, decreased insulin action, and apoptosis and mitophagy. So finally, we'll have a decrease in beta cell mass. So in decreased insulin production, decreased stimulus secretion coupling, ultimately leading on to insulin. You can see in the top, decreased insulin secretion and increased insulin resistance, leading on to diabetes mellitus. So this is why there is no molecule till now which address this mitochondrial dysfunction. So if you take the need of the hour, the treatment option is the action on insulin secretion and insulin resistance and decrease hepatic glucose production, increase peripheral glucose uptake, decrease beta cell apoptosis, favorable safety and tolerability profile, correcting mitochondrial dysfunction. So if you see the mechanism of action of this molecule from the left hand side, if you see, so it partially inhibits complex 1, it reduces the ROS formation, restores complex 3 function, prevents MPTP opening, increases ATP generation. Ultimately, all these things leads to improved beta cell function and beta cell production, which is one important aspect of this molecule. It increases glucose dependent insulin secretion, prevents beta cell death, increases functional beta cell mass. At the right and bottom, you can see it enhances the insulin action like liver, it reduces the excessive gluconeogenesis, decreases steatosis. In the muscles, it increases insulin signaling and stimulates glucose uptake. So coming to the studies, the efficacy and safety of Imeglimin in Japanese patients with type 2 diabetes, a 24-week randomized double-blind placebo-controlled trial, you can see when they see 3 doses, that is 500 milligrams, 1000 milligrams and 1500 milligrams, given the marginal increase in efficacy with 1500 versus 1000 milligram dose, along with the potential for gastrointestinal tolerability issues, a dose of 1000 milligram twice daily was selected for a subsequent phase 3 studies. So these are the 3 studies are there. The times 1 study, it was the efficacy and safety of Imeglimin monotherapy versus placebo. So if you see in this study, they observed as a monotherapy, they observed a HbA1c reduction of up to 0.8%. So what does it say? It's a new promising oral agent for the treatment of patients with type 2 diabetes. Next is the times 2 study. It is to evaluate the safety and efficacy of Imeglimin as the monotherapy of combination therapy with existing anti-diabetic agents in Japanese patient with type 2 diabetes. What they have seen is the reduction of HbA1c of 0.56 to 0.92%. Next is the times 3 study. They did to evaluate the safety and efficacy of this molecule as a combination therapy with insulin in Japanese patients with type 2 diabetes. Here they observed the reduction of HbA1c about 0.54 to 0.64%. So we always ask our data that it's good to have Indian patients as well. So while major trial involved Japanese patients, it would be worth to see our results as well. The study was Indie Times, the largest Indian study on Imeglimin. So nearly 8,000 type 2 diabetic patients were recruited in nearly 190 sites pan India. So you can see the 8,300 patient were put on Imeglimin 1000 milligrams twice daily, and for this results show that there was a HbA1c reduction of 1.12%, fasting plasma glucose of 29, postprandial plasma glucose of 62. So you can see when it is used as a monotherapy, that is reduction of 1.12. When it is used as a dual therapy along with other drugs, it was 1.1, and 2 or more drugs, it was 1.13 reduction. So depending upon the molecule, if you start from the left hand side, when they use alongside sulfonylurea, the reduction was 1.15, that is HbA1c, biguanides 1, DPP4, SGLT2 inhibitors, even insulin, they saw a good reduction in HbA1c. So the comparison of mean changes in HbA1c range across the overall study population and Imeglimin therapy, you can see the red one with the higher HbA1c, the blue one is the 7 to 8% HbA1c. You can see a reduction of 0.8 to 1.4 reduction. So the safety parameters, if you take, we always talk about liver profile, renal profile, and lipid profile. You can see in this slide, there was an improvement in renal parameters, liver profile, and lipid profile. So in the time studies, always when you, whatever this adverse effect they saw in this study, there was a mild to moderate GI disturbances such as abdominal pain, nausea, and vomiting. So one important study we always ask for, what is the cardiac data, cardiac safety data is there. There is no big study with this molecule, but however they have seen there was an absence of QTC prolongation in a thorough QT study with this molecule. What is the studies demonstrated that therapeutic and supratherapeutic exposures of Imeglimin did not induce a QTC prolongation with a strong confidence as evidenced by the assay sensitivity. Another study showing the efficacy and safety and tolerability of Imeglimin 1000 milligram inadequately controlled type 2 diabetes patient is a phase 3 randomized double blind study. So what they saw is Imeglimin monotherapy proved a non-inferior to metformin in improving glycemic control in Indian type 2 diabetic patients with a better safety and tolerability. So you can see in this study the HbA1c with Imeglimin was 0.7 when compared to 0.67% in metformin. Fasting reduction was 17 to 16. 2 hours postprandial is 26 or 25 reduction. Both were similar to the metformin, and safety and tolerability parameters were comparable in both the arms. Next, another study. This is one interesting study. It is a safety and efficacy of Imeglimin in type 2 diabetes individual who are metformin intolerance. This is a case control study. So what did they see in this particular things? Imeglimin offers a practical alternative when metformin cannot be tolerated for healthcare providers. It demonstrated ability to preserve beta cell function may be particularly beneficial in South Asian populations. These features suggest that Imeglimin could not only improve short-term glycemic outcomes but may also modulate disease progression when initiated early in the therapeutic course. The implications for public health are considerable in India. Imeglimin has the potential to assist over millions of people who cannot tolerate metformin. Although it does not serve as a replacement for metformin, it ensures that the principles of early glycemic control and targeting the underlying pathophysiology can continue even when metformin is ineffective. When you see the difference between Imeglimin and metformin, you can see on the right hand side. So on ETC, you can see the complex one is as a competitive or partial inhibition and restores complex 3 function. This is Imeglimin. Metformin is complex 1 non-competitive inhibition. When it comes to mitochondrial respiration, the Imeglimin facilitates, whereas mitochondrial decreases. When it comes to reduction is reactive oxygen species, Imeglimin is there, but metformin is less. Insulin secretion is good. Insulin resistance is taken care with Imeglimin, both with metformin as well. Insulin secretion is not taken with metformin. Hepatic glucose production, both are same. So this is the difference between between the Imeglimin and the metformin. On the left hand side, you can see Imeglimin shows the competitive partial mitochondrial complex 1 inhibition, no decrease in mitochondrial respiration, decreased ROS formation, no effect on mitochondrial glycerophosphate, increased NAD synthesis potentially via NAMPT, increased glucose responsive and intracellular calcium. On the right hand side, you can see with metformin, it's an uncompetitive mitochondrial complex 1 inhibition, decreased respiration, decreased ROS formation. Mitochondrial glycerophosphate dehydrogenase, no increase in calcium, no effect on NAD reported. Effect of imeglimin on daily glycemic profile evaluated by intermittently scanned CGM. It's a retrospective single center observation study. The aim was to evaluate the short-term effects and safety of imeglimin in terms of glycemic control as assessed by intermittently scanned CGM. You can see in this graph, the topmost was the before, the dark one, the light dotted one is after. You can see imeglimin clearly shifted daily glucose profile into an appropriate range in Japanese type 2 diabetes patient, indicating a short-term improvement in glycemic control. What are the advantage, like what are the parameters you have to keep it in mind when it comes to renal? So normally it is 1000 milligrams twice daily. So when it comes to EGFR 15 to 45, it is 500 milligrams twice daily. When it is as the dose has to be reduced, and when it is less than 15, still that there are few studies saying that it can be given as once a day the dosage. So two concerns and a single solution in managing type 2 diabetes. A narrative review on imeglimin done by Dr. Shambhu and Dr. Shashank Joshi was a part of the study, and Dr. Jyotirmay Par was also part of the study, which shows imeglimin's potential in treating type 2 diabetes extends beyond glycemic control, showing promise in addressing various diabetes related complications. Recent studies suggest imeglimin's ability to modulate mitochondrial function and reduce ROS might confer protective effects on organs commonly affected by diabetes. So what are the recommendation imeglimin in type 2 diabetes? What are the expert opinions and consensus in the Indian context? So what is the consensus you see from the experts? You can imeglimin monotherapy. It can be administered as monotherapy in treatment naive patients with type 2 diabetes, could be considered as a monotherapy in patients intolerant to metformin, can be considered in the treatment of postprandial hyperglycemia. Imeglimin combination or add-on, it can be considered as an add-on therapy to metformin, sulfonylureas or DPP-4 inhibitors, considered as add-on therapy to metformin, sulfonylureas or DPP-4 inhibitors, is considered as add-on therapy to SGLT2 inhibitors as well, can be used along with insulin as add-on therapy in patients with type 2 diabetes. For the patient supposed to be on insulin with very high doses comes to you and says still the sugar is not under control, doctor don't increase the insulin, this molecule can be considered. Imeglimin 500 milligrams twice daily can be considered in patients with diabetic kidney disease having EGFR 15 to 45. Imeglimin add-on can be considered for treating elderly patients. So ladies and gentlemen, the take-home message from my talk. So the mitochondrial dysfunction is the common thread linking beta cell failure, insulin resistance and increased gluconeogenesis. Imeglimin uniquely restores mitochondrial health to correct both facets of type 2 diabetes. It acts simultaneously on the pancreas, liver and muscles. It marks a paradigm shift targeting a root cause of diabetes. It demonstrated good efficacy with monotherapy and also with combination therapy in large-scale real-world evidence conducted across India with mean HbA1c reduction of 1.12 after 3 months of imeglimin therapy. Thank you for your patience hearing. If you have any questions, we can discuss.
Thank you, Dr. Aravinda.